around after. Please stick around after the interview to see some clips of my show, including a live performance of my song, The Symptoms.
Greetings, everybody. Welcome to Better Call Paul. This is the first in my interview Royale series where I interview interesting and important people. Today, I am joined by my good friend, Joshua Renfroe. Dr. Joshua Renfroe is here, and he's going to talk to us about Pandammit, how a small SOB is causing big problems. We're going to talk about coronavirus. We're going to talk about things you can do to protect yourself, and hopefully we'll get a lot of your questions answered because there's a lot of information out there and a lot of it's not true. So, Doctor, why don't you introduce yourself, give us your background a little bit?
Great, thanks, Paul. It's very nice to be here, and thank you for having me on. Currently, I'm a research scientist working at a pharmaceutical company in Richmond, Virginia, working vaccine development, and I've spent a couple of years working in biotech startups out of the University of Georgia. And before that, I did my Ph.D. at Georgia State University in applied environmental microbiology, working on large-scale development of vaccines, particularly respiratory syncytial virus vaccine. Before that, I did a master's in science and molecular genomics and biochemistry at Georgia State University. And before that, I did a master's in public health in epidemiology and biostatistics, too, at Georgia State University. So I'll give a little bit of background about COVID-19 epidemiology. Epidemiology is a study of diseases as they move through human population. First, I'll outline the disease severity of COVID-19. And the reason why I wanted to bring this up is because, as you know, a majority of the infections are asymptomatic. And this is a little bit deceiving when you think about it on a population scale. But 80% of the people that get infected with COVID-19 are asymptomatic. About 14 or 15% have a severe case that requires some sort of hospitalization. About 5% have critical ICU needs.
If we make some changes as a society, it doesn't have to be as bad as it could be. I wanted to ask you a question. I mean, so, you know, you're seeing there that the percentage of death looks like it's under 1%, right? Which could, cause somebody to think, well, that's not that bad, or it's only, for somebody who's, really already sick and I'll be fine. But you're going to go over with us a number of reasons why it's so important to wear a mask and take other precautions so that it doesn't overwhelm our hospital system, which I know you're going to get into that. And not to mention, on a personal level, my mother has emphysema, which is a progressive lung disease. It only gets worse. It never gets better. And so she is one of the people that is most susceptible to any illness, but the coronavirus in particular. And so that's why I have a personal, stake in protecting her as well.
Right. I mean, 15% are having to go to the hospital, 5% are ending up in ICU, and that is not a pleasant way to live. I mean, ICU is miserable. If you get on a ventilator, you can be on a ventilator for 2, 3, 4, sometimes even a couple of months on the ventilator, right. Hanging on for your life.
Absolutely. And so why don't we go into the burden on the healthcare system?
Yeah. So again, hospitalizations can last weeks to months. That's taking up an ICU bed in the hospital. Case surge can happen very quickly. That just overwhelms the hospital system in general, and that has effects on other areas of healthcare as well. So other things aren't being treated. ICU beds, equipment, staff, personal protective equipment are all in short supply when this happens. So then at that point, death becomes more likely because people are getting poor treatment.
And this is also things that normally wouldn't have killed you or wouldn't have had so many complications because they're completely overwhelmed at this point. As we're having this interview right now, hospitals in a bunch of states are really getting overwhelmed. And I do want to explain to our viewers that even though I'm here in sunny California on the beach, just relaxing, you have a thunderstorm there where you are. Yeah, so that's that noise that you hear periodically is just nature's wrath.
Yes.
Speaking of nature's wrath, let's move on to flattening the curve. Let's talk about things we can do to mitigate this crisis.
So the idea behind this is that through interventions such as social distancing, wearing masks, taking care not to infect other people, you essentially flatten the curve of number of cases at one time. So this purple represents here the number of cases. And so if they're all pushed together, if they're all happening at one time, it overwhelms the threshold of the capacity of the healthcare system. So that line going across is the capacity of the healthcare system. That's how much a hospital can take at one time without being overwhelmed. So the idea is if you slow that infection down, it's thought that at some point, everybody will become infected. So if you flatten out that curve, the hospitals will be able to take care of the burden. And that's actually the biggest, most important thing about these interventions.
Right, is giving physicians and medical personnel space to care for not just COVID-19, but everything else that happens.
Right, and if our healthcare system falls apart, and that's what would happen.
Right.
Healthcare system would fall apart.
Right.
That's terrible for everything. Mm-hmm. So nothing can happen without a healthcare system. We that's the number one priority.
Right, and again, just that could be helped, and we'll get into more detail. But wearing a mask, washing your hands thoroughly. I'd like to just share really quickly. Before all this happened, I worked at the illustrious Benihana. I love Benihana. I have a little Benihana shrine. Here's my, I've had to retire my uniform, but when working at Benihana, we have to, as part of our job, we sing happy birthday to people twice. And they say that washing your hands, if you sing the song happy birthday twice, that should be about enough time that you spend washing your hands to be thorough. And so, I do it now, and now I'm in the habit. I'll do it for the rest of my life, probably, where I do.
Happy birthday to you. Happy birthday to you. Happy birthday. Happy birthday. Happy birthday to you.
And I totally butchered the Japanese, but they can't fire me now.
Any time that you're in a small enclosed space without circulating air, you're at risk of catching something. So that's why indoor venues, large crowds are very much discouraged. Bars, nightclubs, things like that.
Our economy will completely tank, and we're already in a bad spot if we don't do something. So I just wanted to say that there's another reason besides just our health, right? To do these things and look out for each other.
And this is easy, Paul. I mean, if we had a drug that could reduce transmission by 80%, everybody would be over it. This is easy. This is a matter of just putting something over your face.
Right.
Like it's low hanging fruit.
We want to get through this as a people, as a society, as a country. We want to get to the other side of this whole thing, and we can do it if everybody works together, listens to scientists, listens to the people who are here to protect us, and respect the medical professionals that are trying to save us, and do the things that are now, that are being asked. Thank you so much, Doctor, for coming on the show, and for taking the time to do this, and for then later answering people's questions, which they're going to get an opportunity. So, thank you.
Oh, no problem, Paul. It's a pleasure, and it's great. It's great to see you. It's great to see this format. It has a lot of things happening for it. It has the potential to be very creative and do a lot of different things. And I'm very excited.
Thanks a lot. Thank you so much. And go ahead and put the first title card up, the typical of your sense of humor. I think it's great. Pandammit, how a small SOB is causing big problems. Thank you for joining us on the first of my interview Royale series. And I hope to see some of you or all of you soon on my Twitch channel, Better Call Paul with a 1, and YouTube and every other thing once I come to grips with the technology and figure it out. So thank you and good night.
Got the symptoms. You got the symptoms. Oh, you got it so bad. Now I know you feel it too. Oh, what is wrong with me? What is wrong with me? What's wrong with me? It's a crazy world and it all feels wrong, so I'm gonna stay home and sing this song. And everybody out there, yes, including you, is invited. Get excited for your favorite dude. Fun is what we'll have. We'll play some games and share a laugh, cause after all is said and done, when the walls fall, we have won. If you wanna share the love, better call Paul. Better call Paul. Finally have some good news for us all. Better call Paul.